Dineshan, shall we start?
Yes, Dr. Lahiru, we'll start now.
Right. Okay. Good evening, everyone. I'm Dr. Lahiru. Thank you for the opportunity. I was informed that you need to know about the dengue program as well as some of the disaster aspects. The disaster management as well as COVID-19 and vaccination as well. So I'll conduct it in English and time to time I'll discuss it in Sinhalese as well. Is there anyone who doesn't understand Sinhala?
Yes, sir. Yeah.
Yeah, shall we do it in English?
Right. Then we will continue in English.
Right. Okay. Right. Thank you.
Yeah. Okay. Sure. So first of all, what area you prefer to start? Firstly, I think now since you are having it on May 1st, 5th, no?
Yeah, 5th of May.
5th of May, right? So it's better if you can. This is how we did it. I think some of my batchmates are also here. So basically, you have to have sort of a plan before you go for the exam, because it's a race against time. Basically, the paper is a race against time, because normally until the last minute you have to write, right? So plan your exam and plan your answers very well. Otherwise, you will end up with writing a complete essay to one question and then very little summary to another question. So you have to balance it. If you balance it, you will easily pass. So what I did, I will share my experience. I am not that good in stat, right? So what I did is I basically started off with my strong areas, right? So I was good in planning, health promotion, disaster management, then COVID-19 questions. I started off with those questions, right? Where I can score more, right? So I basically wrote down those questions, the answers, and then finally went for this statistics question. But it can be either way. Now, if you are good in statistics and if you are good in epidemiology, you can start off with this statistics and epidemiology, but don't spend time more on one question. That's the issue, I think, in the written paper, right? Most of them fail because of this time management issue, right? So it's better if you can somehow identify your strong areas, right? Focus on that one and then move on to the next question or next area of interest, right? So that will be, you have to plan it all, right? And the other thing is now, since lately, the questions are not sort of clearly demarcated, right? They have part of health promotion, they have part of planning, they have part of risk communication, all into one, right? So when you plan a question, for example, one question on COVID-19, then they will ask one part from risk communication, one part from COVID community engagement or mobilization, one part from planning, right? So you have to sort of plan each subsection as well, how you manage time, right? So before you go to the real exam, I think you must have been practicing as well now. Practice these sort of how you manage your sections, right? That's how you can easily pass the exam. So if you have any questions in between when I'm talking, just raise your hand and ask the questions as well, right? Have you gone through the past papers now?
Yeah, we are doing, yes.
Right. So you are doing it section wise, or the entire paper you time it and do? So
At the moment, we are doing section wise. Some of them are doing the whole paper also.
Right.
Yeah.
So better to do it section wise, and some for some sections better to have some short notes as well. at the last moment you can refer, no? For especially regarding this planning and all, planning Susi madam did, right?
Yes.
Right. Okay.
And Samarage sir.
Samaragi sir, right. Oh, okay. Yeah. So that is how, I mean, you have to plan the exam, right? So there are a few things that for every question, for example, now if you get a question on COVID-19, or if you get a question on disaster management, or say any other thing, I mean, as a community physician or a community practitioner, you must have some sort of basic knowledge on these areas. For example, how to do a SWOT analysis. You know about SWOT analysis, right?
Yes.
Right. So you can now sort of how you plan for the exam is now you can apply this SWOT analysis to most of the questions, right? They expect some of the terminologies. For example, if you know if you put a SWOT analysis for a question, they know that you know the terminologies and you know the basics, right? So SWOT analysis is very important, and also some sort of how you plan your situation analysis. Have Susi madam done the situation analysis part?
Samaragese, I think.
Sorry?
Samaragese had
Samaragese
done
had
that part.
Right. Entire situation analysis, including this problem tree and pestle analysis
Yes.
and all.
Yes.
Right. So that's good. I mean, you have to sort of have a clear idea about these situation analysis, right? Then the logical framework. Has it gone through? Logical framework and the results framework.
Yes. Yes.
Right.
Yes.
Right. So this logical framework, results framework, and the monitoring and evaluation part, and these 5 criteria for evaluation, those things you have to apply everywhere, right? So have a very clear understanding about this, how to do a situation analysis properly, how to do a SWOT analysis properly, and how to sort of identify the key problem, or how to prioritize the key problem, as well as this log frame, right? So most of the time they include questions, sub questions in every question. I mean the planning part, right? So that is important. That is important in every aspect, right? So we will start with this VPD surveillance and this COVID-19 vaccination. Since you asked for this COVID-19 vaccination, Samita sir did it, right? COVID-19 vaccination. Samita sir did the COVID-19 vaccination.
Yes.
Right. So anyone of you know about the criteria for an effective VPD surveillance, vaccine preventable disease surveillance? What are the criteria? Right, for a VPD surveillance, so vaccine preventable disease surveillance, right? That is now when you are going to introduce a new vaccine to your program, you should have a proper surveillance system as well, no? So to develop this kind of surveillance or a VPD surveillance and prioritize, you should have some criteria, right? The first criteria is the disease burden of that particular disease within the country, right? First one is the disease burden and the endemicity, right? For example, now if you say dengue is a hyper-endemic disease in the country. What is hyper-endemic? Anyone of you can answer if you know. What is hyper-endemic? What do you mean by hyper-endemic?
Higher number of cases throughout the.
Yes. Basically, that is the answer. Yeah, correct. Higher number of cases continuously throughout any given year. If you find cases, irrespective of the seasonality, it's called endemic or hyperendemic, right? So to decide on a vaccine or a VPD, vaccine preventable disease surveillance, first you have to have idea about the disease burden. That's the first thing, and the endemicity of that disease, right? Then the second thing is you should have an idea about the severity of the disease, right? What is the case fatality rate, or what are the complications? Now, For example, if we introduce a vaccine for a very mild disease, right? So the expected outcome must not be achieved, right? Sometimes, right? So to achieve the expected outcome or to cure the disease or to control a disease, right? You should have a very clear idea about the severity of the disease as well, right? What are the complications and what is the fatality rate, right? So that is the second point, right? Even for the COVID-19 vaccination and COVID-19 surveillance, right? We have sort of identified these criteria. First one is the disease burden and the endemicity. Second one is the severity of the disease or complications and fatality, right? Then the third one would be the epidemic potential, whether this particular disease have epidemic potential, right? Or else this is a very mild disease, which is sort of very low potential for creating outbreaks or epidemics, right? So you have to differentiate whether this has a very high epidemic potential. That is the third point, right? So you have your disease burden and the endemicity. You have to decide on the severity of the disease, right? Complications and fatality rate, epidemic potential, right? So the other thing is potential for emergence of virulence, right? Or mutations. Now, this particular disease or this particular agent has a chance to sort of mutate, right? Or there's a chance of higher virulence, right, in the future, right? So if you have that kind of a vulnerability, you must have a VPD or vaccine preventable disease surveillance system for that kind of diseases, right? Potential for emergence of virulence or the mutations, right? Then prevention, control, and elimination potential, right? When we apply a vaccine for a particular disease, we should have an idea about how to prevent it, whether this introduction of vaccination will prevent the disease, whether this introduction of vaccination will control the disease or eliminate the disease, right? So you should have a clear idea whether to prevent this, whether to control this, or to eliminate this, right? So the potential of prevention, control, and elimination, you should have a clear idea, right? So you have the disease burden first, and the endemicity, then the severity of the disease, then epidemic potential, then potential for emergence of virulence or mutation, then prevention, control, and elimination potential, right? So those are all sort of epidemiological parameters, right? So the introduction of a vaccine or a development of a VPD surveillance is not only epidemiological parameters. You should have some other parameters as well, because we are introducing it not to a very small area, we are introducing normally for the entire country, or we are piloting it for 2 or 3 provinces, right? So the other parameter you should have is social and economic impact, right? The cost benefit, right? We are investing some money on this, and what is the gain or what is the output we are getting out of this entire endeavor, right? So the social and economic impact, you must also have an idea, right, before introducing a vaccine or a PPD surveillance program, right? The other thing is international obligations. So anyone of you can tell me what are the international obligations when it comes to sort of vaccine preventable diseases, or when it comes to infectious diseases? Tell me 1 or 2 international regulations that we are bound by the international community. IHR, yeah, that's the core international regulation, right? So international health regulations. So we are bound by international health regulations to prevent or the introduction of infectious diseases or any other potential infection from our ports of entry, right? So IHR or international regulations is another point that we should consider when we introduce a vaccine or a VPD surveillance program, right? Then the most important thing is public perception of the risk. Now we are introducing a vaccine, right? say for example, we are introducing a vaccine for common flu, right? What do you think? People will come in queues to get the vaccine. What do you think?
No, they won't come.
No. Yeah. So the perception of risk is much lower. When you consider a sort of a disease like COVID-19, compared with the common flu, the chance of people coming to get a vaccine for common flu is comparatively less, right? So the public perception matters. Now, when you introduce a vaccine or when you introduce a VPD surveillance program or when you prioritize a VPD surveillance program, the public perception of the risk of the disease is of utmost importance, right? So you have to have some idea about that one as well, right? And the other thing, the final criteria is logistical constraints and all other logistical support. Now, you should have some infrastructure and you should have some logistical requirements to fulfill your needs, right? Before introducing a vaccine or a VPD surveillance, right? So these are the criteria. Now, if a question asks from you whether now, for example, now what they ask is, can you justify the introduction of COVID-19 vaccination during this period? How you justify, right? So to justify your introduction of a vaccine, right, or a new product or a medicinal product, you should have these criteria, right? You should have a clear idea about the disease burden and endemicity, right? Severity of the disease, then whether there is any epidemic potential, whether the potential for emergence of virulence or there is any mutations, right? Prevention, control, and elimination potential, then the socio-economic impact of introduction, international regulations like IHR, then public perception of the risk, and these logistical and other infrastructure constraints, right? So those are the areas you should consider when you introduce a vaccine or a VPD surveillance program, right? Any questions or is it clear?
Yes, it's clear.
Right. Okay. Now, then it comes the question, they can ask, now we have introduced the COVID-19 vaccine, right? So what are the limitations you expect? What are the constraints you expect, right? When you introduce COVID-19 vaccine along with the COVID-19 surveillance program. So you should have a surveillance program to monitor it as well. No? So what are the limitations? So can you tell me one or two limitations that you can expect?
Sustainability of the vaccine.
Yes, sustainability. Now, when you tell the term sustainability, it's a broader term, no? So you have to sort of specify how you can define sustainability there.
Financial sustainability.
Yes, that's the correct word. Financial sustainability. So that's a big concern, whether we can sustain the entire program for a longer period, because we are a middle income country and we have a very limited health budget. So whether we will be able to sustain a new vaccine or a vaccine preventable disease surveillance program in the longer run, right? So what are the other constraints? So other constraints would be, now very correctly, this economic sustainability or the financial sustainability is the issue, right? And in case of epidemiological parameters, when you consider epidemiology, right? So for example, say now underreporting of cases. Now we have the vaccine, we have created a very sophisticated surveillance system as well, but there is underreporting from the grassroots level, because they don't have sufficient human resource or logistical resources to sustain that one. So there will be underreporting. When there is underreporting, we are not serving the purpose of this introduction, right? So that's a limitation. Underreporting or missing data, right? When you have underreporting or missing data, what is the problem with that? You can't generalize, right? Now, every vaccine preventable disease or every vaccine introduction, you should have some data set, no? So you take the data set from samples you acquired from grassroots level. Now, if these samples are not adequately representative, there is underreporting, there is missing data, you can't generalize, right? So you can't come to conclusions whether this is successful vaccination, whether we have to improve it on it, right? So you can't basically have a clear idea, right? So that's one limitation. Then there are sentinel sites. So everyone knows about sentinel sites, right?
Excuse me?
Sentinel sites, you have idea, no? For example, now for dengue, we have around 100,
Yes.
107 to 108 sentinel site hospitals where you report dengue cases on a daily basis into a online system, right? So if your sentinel sites are not representative, for example, now you are giving the vaccine for the entire country, but your sentinel sites are purely concentrated on Western province. So you can't get a clear idea. You can't get a feedback from other provinces as well, right? So if your sentinel sites are not sort of representative, that would be a limitation, right? Then missing key variables. Now you have already started your vaccine and you have already started your VPD surveillance, but there are variables that are missing when you report. For example, age, right? Some cases when they report, there is no age, there is no sex, all right? There is no age categorization, right? Something like that. So these kinds of limitations, these are epidemiological limitations, right? So if you are underreporting or you have missing cases, then if you have sentinel sites which are not representative, if there are any missing variables, right? Then the other important thing is the health seeking behavior of the people. Now, even though you have very nicely created a vaccination program, if the health seeking behavior of the people is limited, then you have issue. For example, when you consider the the booster vaccination of the COVID-19 vaccine, there was an issue with this health seeking behavior, right? People are not coming forward to take the COVID-19 vaccine. Reasons can be many reasons. There can be many reasons, but it's a basically issue with the health seeking behavior of the people, right? So those kinds of limitations you have to know. Now, this can be applied into any other case as well. Now, not particularly for COVID-19 vaccination. If you are going for a vaccine introduction, right? Or a VPD surveillance introduction, these are the criteria and these are the limitations that you should identify, right? So if they are asking
vaccination or for the VPD surveillance?
Mainly for VPD surveillance, but it's almost same for the vaccine introduction as well, right? Mainly for the VPD surveillance. Right? They normally ask about these things, right? Well, now we are expecting that they will ask about COVID-19 vaccination directly, but not as such. They will ask about a VPD surveillance. Through that, they will ask about the vaccination, right? So these are the basic sort of criteria and limitations, right? So
What about the what about the logistics?
yeah, logistics will be a limitation. Yeah, logistics will be a definitely limitation. Now, the main limitations would be now when it comes to VPD surveillance program, these epidemiological parameters will be the main limitation. Then you have those other limitations as well. Health seeking behavior of the people, logistical constraints, economic sustainability, right? Those kinds of things you have to have an idea as well. That's very correct. You can include them as well, but give priority to the most important things first when you write, because they look at in a very epidemiological angle, no? So you have to give a priority for that part, right? So any other questions on that one? Sorry. So any Either submitted. So anyone has done you about the new vaccine introduction? What are the phases and all? Right. So I will go through it quickly as well. If you can note down, take down some notes, you can take down some notes as well on this one. New vaccine introduction. Have anyone done it? New vaccine introduction. What are the criteria for a new vaccine introduction at the global stage? Right. Ekat product, you have to have some idea about this one as well, right? Now, when you introduce a new vaccine, there are a few considerations that you have to have in your mind, right? First one will be the global considerations, right? Whether globally or regionally they have any elimination, eradication targets, right? So global considerations would be the first one. When you introduce a new vaccine, the first consideration is the global considerations. Whether globally we have a eradication target, whether regionally we have elimination or eradication target, right? So that has to be clearly demarcated, right? The second one is the evidence of disease prioritization. Sort of now, as I said earlier, what is the burden of this disease? What is the incidence of this disease? What are the risk factors? What is the prevalence, right? So evidence of disease prioritization. So you should have the sort of data to prioritize this disease, right? For the vaccine introduction, right? Then availability of a suitable specific vaccine. Now, even we are thinking about introduction of a vaccine to a particular disease, if we don't have a specific disease that has gone through all these clinical trials, if you don't have such vaccine, you can't introduce a vaccine. No? For example, now for dengue, you have several vaccines. You have a vaccine called Sanofi, you have a vaccine called Takeda, right? Some of these vaccines have gone through the phase 3 clinical trials as well. Some have been introduced in other countries as well, but there are issues with all these vaccines. So once you don't have a vaccine, a definite vaccine for that particular disease, you can't introduce it. So availability of a safe specific vaccine is also important, right? Global considerations is the first one. Then the evidence of the disease prioritization, evidence for the disease prioritization, then availability of a safer vaccine. Then the other point is target population. Whether we have identified our target population, whether this vaccine will work on the adult age cohort, whether this vaccine will work on the pediatric age cohort. So we have to have a target population as well, right? Target population identified, right? Then the efficacy and effectiveness of the vaccine, right? Efficacy and effectiveness of the vaccine. These words have, just read on these words as well, right? You know about the difference between efficacy and effectiveness, right? Anyone know the difference? Right? Anyone know the difference? Read about these words, effectiveness and efficacy, right? Now, effectiveness is when you sort of test the, not as test, when you give a vaccine to a larger population, when then you retrieve some data from that population, then we see the effectiveness, right? So it's sort of from a larger population, right? Efficacy, what we see is efficacy we see in small groups, sort of. Now, when you go through these clinical trials, you see the efficacy. Now, this efficacy can differ from one laboratory condition to another laboratory condition. Now, that is why they don't tell that. Now, for example, when the COVID-19 vaccine was introduced, right? So they say that AstraZeneca is 90% in efficacy, and others say that Sputnik is 80% in efficacy, for example, right? So people start comparing these efficacies. Now, this efficacy cannot be compared in that way, right? Because efficacy, you test these vaccines, or you develop these vaccines in different laboratory conditions, right? Different parameters were used to test these vaccines as well, right? So you can't sort of compare this efficacy. Effectiveness is when you introduce the vaccine into a larger population, your general population, and when you get the data of how successful this vaccine is, then that is the effectiveness, right? Yes, that is exactly correct, Shalini. Yeah. Efficacy at the lab and effectiveness at the field. That means in the general population, right? Right. So you should have an idea about efficacy and effectiveness of the vaccine as well, right? Then the benefit of the vaccine to individual as well as for the population, right? Now, what is the benefit of the vaccine to the individual? It's basically the curing or the control of the disease, right? What is the benefit for the population? Now, if you achieve herd immunity, then that would be a benefit for the population, right? So you have to have an idea about the benefit for the individual as well as benefit for the population, right? So that's another parameter. Now you have the global considerations, then you have the evidence for disease prioritization, you have the availability of a safer vaccine, then you have identified the target population, the most effective target population for that particular vaccine, then efficacy and effectiveness of the vaccine, then benefits for the individual and the population, right? So those are the considerations when you introduce a new vaccine. The other thing is, as you earlier said, cost effectiveness and cost benefit. Cost effectiveness and cost benefit. What are the things that we get from the inputs we are giving, from the financial inputs we are giving, right? Then the other thing, as you said, these logistical constraints and all, right? That is the implementation feasibility. What you call implementation feasibility. Implementation feasibility means now the population should accept this vaccine, no? So acceptability of the vaccine, right? Then the cold chain management, then waste disposal. So all those things, right? Those are some of them are logistical constraints, no? So implementation feasibility, you have to have some idea, right? Now the final thing, additional opportunities. For example, now when you introduce a new vaccine to our immunization program, then that will be added advantage for the immunization program and the health system. So the not only preventing that particular disease, but that is the advantage for immunization program and the health system as a whole, right? So additional opportunities is another consideration. Now you have all these considerations before you introduce a new vaccine, right? So no need to memorize entire thing, but have some idea. Now, when you introduce a vaccine, these are the things that they consider, right? Any questions on that? Whole chain එක ගැන දන්නවනේ නේ? ඒක නම් පණන් කරලා ඇතිනේ. Whole chain okay නේද?
Okay.
Whole chain එක බලාගෙන whole chain එක ගැන අහනවා හුඟක් වෙලාවට. Any questions on this one? Yeah.
What is the exact difference between cost effectiveness and cost benefit?
Yeah, that's another yeah. Now cost effectiveness is, now when you go for the effectiveness of a program, you have sort of your expected outputs, no, right? You have some expected outputs out of this program, not essentially a vaccination program. Any program, the effectiveness is the difference between the need and the outcome, right? Efficiency means the difference between the input and the output, right? So effectiveness, cost effectiveness is for your need, you will invest some money, and the outcome, you expect some outcome, right? For example, for the vaccine, right? You invest some money, you have a need to introduce this vaccine, and your outcome would be prevention of this disease. Now, whether you have achieved this outcome from the input or the need you have invested is the cost effectiveness, right? Cost benefit is there can be a benefit. Now, even though in health economics, there are different terminologies for these two, but in case of a vaccination program or a program perspective, the benefit is you can have many benefits, but whether you have achieved your outcome is the effectiveness, right? You can have benefits even though you have not achieved your entire outcome, right? Now, after introduction of this COVID-19 vaccination, you can have many benefits, but your ultimate outcome is to achieve, for example, 70% or 80% herd immunity. Now you have achieved your benefits, but you have not achieved the ultimate outcome. So when you are not achieving the ultimate outcome, the cost effectiveness is not there, but there can be some kind of cost benefit. Understood?
That means other than the disease prevention, there are other benefits
Yes.
also. Those are
Yeah.
the things.
Yes.
Right.
Now, yeah. Now, when you introduce, you have done. Now I told you earlier. Now, when you introduce a vaccine, you have your main focus. Now, for example, prevention of disease. Rather than that, you also have some other ideas as well to improve our immunization schedule or improve our health system. Something like that. Broad ideas, right? So effectiveness is whether you have basically achieved your outcome, what you have intended at your initiation, but benefits can be different.
Right.
Okay, no?
Right. Thank you, sir.
Yeah. Okay. Then anyone told you about this introduction? I mean, the process of introduction, trials, number of trials, how they introduce the vaccine, COVID-19 vaccine, and all.
Not on COVID vaccine.
Generally vaccine generally vaccine එහෙම කළේ නැහැ නේ vaccine development stages ටික නිකන් දැනගෙන යන්න I will tell them these things this vaccine development and all they will not ask you directly, but better to have idea, then you can, I mean, you can score more when you introduce these things into your answer, right? For example, now there are several stages of vaccine development. Now, first thing is the pre-clinical stage, right? When you develop a new vaccine, pre-clinical stage is the first one. Now, in the pre-clinical stage, what you do is, first you test the vaccine in the animals. For example, this is the process they started in COVID-19 vaccine as well, right? So they test the vaccine in animals first. Why they test the vaccine in animals? To know whether there is an immune response triggered. Now, when you introduce a vaccine, there should be immune response. No, there should be a triggering of an immune response, right? So first they see on animals whether there is an immune response triggered. So the first one would be the testing in animals. That is the preclinical stage, right? Then they come to the human trials. Now in human trials, there are different phases as well. Now phase 1, they choose a very small sample, right? Basically less than 100 people, right? That can differ from vaccine to vaccine, but basically less than 100 people, very small sample. Then they test the safety, dosage, and the immune response. Those three they will test first. whether there is any immune response, whether the vaccine is able to trigger an immune response. Then the dosage, what is the dosage? They will test with different dosages, and the safety of the vaccine, whether it is safe to continue further. Now, if they identify that this vaccine is not safe to continue further, they will terminate the process. Now, even in COVID-19 vaccination, around 50 to 60 vaccines were there on the trial. Several vaccines were terminated. The process was terminated because they got to know that this is not safe for human use, right? So in the human trials, phase 1 is a small sample trial where you test your immune response, safety, and dosage, right? Then the second stage or phase 2 in human trials is you get a sample of 100 or more than 100 people, 100 or more than 100 test subjects, right? You stratify them into age, you stratify them into risk criteria, right? Something like that. You stratify them into different age cohorts, right? You stratify into different risk categories, right? Then they test the vaccine on them, right? So the idea is whether this vaccine act differently on different groups. For example, now you give the vaccine to a age cohort between say 5 to 15, and also you give the vaccine to a age cohort between 15 to 30, and you test whether this vaccine will behave differently on different age groups. Then you give the vaccine to a group where you have a higher risk of MI within next 6 months, and a group where you don't have a risk of MI in next 6 months, right? You test whether this vaccine behave differently in these different categories. So that is phase 2. In the phase 1, you test whether it is safe and whether it is triggering an immune response and what is the dosage. Then on the second or the phase 2, you test whether there are any difference between different categories, right? Then the phase 3, you have a very huge, large sample, right? Thousands of people, so thousands of test subjects, right? Then you test for this efficacy and safety, right? So you have a very large sample and you test for efficacy and safety. Now, first, it's only very few people, sample size is less than 100. Phase 2, it's 100 or more than 100. Phase 3, it's usually 1,000 or more than 1,000, right? And in different phases of human trials, you test different criteria. Just have an idea, right? So you have the animal testing first, then you have the human trials. Human trials, you have 3 stages, phase 1, phase 2, phase 3, right? Then phase 4 is post-market surveillance. Something called post-market surveillance. I will discuss it later, right? Then now you have the preclinical stage, you have the human trials, then you have what you call independent reviews, right? Now, for example, now if the AstraZeneca originated from England, now approval of that specific vaccine approval board of that specific country is done during this independent reviews. They independently review the efficacy and other parameters of the vaccine, right? Then they go for the regulatory review. In every country, you have a NITAC, right? Or a sort of a vaccine regulatory body. Now in Sri Lanka, what is the regulatory body for the regulation of medicines and all those vaccines? NMRA, yeah, right? So they go for the regulatory reviews. Now when you introduce the AstraZeneca, now AstraZeneca should pass through the regulatory body of the United Kingdom, right? So that is done during this independent reviews, right? So you have the preclinical stage, you have the human trials, right? Then you go for these independent reviews, right? Then you go for what you call WHO pre-qualification, right? Now during this WHO pre-qualification, experts from different parts of the world and experts from WHO, they normally review the production process of this vaccine, whether it is safe, right? Whether they are adhering to these stipulated protocols, right? So they are reviewing the product process as well as the quality aspects of the control process, quality aspects of the vaccine development process, right? They visit the laboratories and they visit the factories and they inspect, right? So that is called the WHO pre-qualification stage. So that is the sort of fourth stage, right? Then what they do is when it passed this pre-qualification, WHO pre-qualification, they publish it in the WHO website, right? These are the vaccines under trial. These are the vaccines, and this is where the vaccine is currently processing in preclinical trials, in human trials, phase 1, phase 2, phase 3. Or it has already passed the independent reviews and WHO pre-qualification, right? So they publish it in their website. So that is the fifth stage, right? The sixth stage is they have what you call SAGE committee. Anyone knows about SAGE committee of WHO? ඔය WHO website එකේම නිකන් ඉන්න වෙලාවට පොඩ්ඩක් ගිහින් බලන්න. SAGE committee එක දන්නවද? SAGE is Strategic Advisory Group of Experts in WHO. SAGE, Strategic Advisory Group of Experts, right? So these are sort of a pool of experts that will go through the entire process, right? See whether there are any gaps, see whether there are any deficiencies, and they give the recommendations. It's not a sort of approval, it's a recommendation. Recommended that this can proceed further, right? So after publishing in the WHO website, they go for the SAGE, right? Or Strategic Advisory Group of Experts in WHO, and they give the recommendation to go further, right? Then only these individual countries, for example, now we have the AstraZeneca vaccine gone through the regulatory bodies of United Kingdom. They have gone through the WHO. They have gone through the SAGE, and they have the SAGE recommendations. Then only individual countries can decide whether to accept the vaccine for their process or not. Not to give to the public, whether to accept the vaccine for their individual countries to follow their process. They have their own process, no, right? So that is how normally a vaccine is developed, and that is how a vaccine vaccine that is developed in United Kingdom comes to Sri Lanka, right? Okay.
Yes.
Right. So think that now this COVID-19, this AstraZeneca comes to Sri Lanka, right? So what is the process then? Now, first, the country experts, for example, the focal point epidemiology unit, right? Then the colleges, the relevant colleges, college of physicians, college of pediatricians, right? College of community physicians, you name it, all the experts from universities and all, they have to do a sort of a needs assessment, right? They do a needs assessment, whether there is a real need for this vaccine to come to Sri Lanka. That has to be decided, right? First, they do a needs assessment. This is after individual country decides whether to accept it or not, right? Process simultaneously that this can be happening simultaneously with the global process as well, right? So needs assessment. Then there's a advisory committee called Advisory Committee on Communicable Diseases, right? Advisory Committee on Communicable Diseases. They will evaluate the vaccine then, right? Evaluate with the whether this is needed, what are the advantages, what are the disadvantages, whether it is cost effective, right? Whether it will be accepted by our population, whether we can sustain this program in the long run, right? So they evaluate the process, evaluation at the Advisory Committee of Communicable Diseases, right? Then only they can proceed to the NMRA, or the National Medicinal Regulatory Authority, right? After the evaluation by the Advisory Committee on Communicable Disease, then the approval can be granted by the National Medicine Regulatory Authority. That approval can be different stages. I mean, it can be an emergency use approval, it can be a general use approval, right? So that approval has to be given by the National Medicinal Regulatory Council or NMRA, right? Then the process doesn't stop there. Then it goes to the drug evaluation subcommittee within the NMRA as well as in the Ministry of Health, right? After that one only, you will get the, for example, the epidemiology get the green light to go ahead, right? So it's sort of a very rigorous regulatory process. Now you can understand from the development of the vaccine, right? A vaccine were developed in the United Kingdom to come to Sri Lanka. How far they have to come? For example, it's a very rigorous process, right? Why this rigorous process is there? Now, have you, anyone of you have heard about the Sanofi vaccination? I mean, the dengue vaccine debacle. Now, there was a vaccine introduced in several countries for dengue, right? So all these WHO and all other organizations were very much behind this vaccine, that this will sort of be a cure for dengue as well. Now they introduced the vaccine in Brazil first, then they introduced the vaccine in Philippines, right? And they came to Sri Lanka as well. But our regulators, even though after going through this WHO process as well as in countries process, they basically not accept this vaccine because they suspect that they have missing data, right? They have not enough data for them to accept this vaccine. So Sri Lankans rejected this vaccine. But Philippine authorities, they readily accepted this vaccine and they gave the vaccine to the pediatric age group, right? Then after a few months, there were cases of dengue deaths among pediatric age cohort, right? Then when they investigated these cases, right, then only they understood that this vaccine could be given only to a seropositive individual. That means one who has previously diagnosed with dengue, right? Only they can be given this vaccine. Now, the new ones who are not even sort of, they haven't had the dengue infection for the first time, then they were this vaccine was acting as a dengue virus itself. So there were a big political issue in Philippines, and the minister has to resign as well. So that is why when you decide on a vaccine, you should have this rigorous criteria, right? Okay, any questions on this one? I mean, the vaccine development and vaccine approval process. Any questions? Clear there, right?
Yes.
Right. Okay. COVAX again, then you know about COVAX now? COVAX, COVAX facility, you know about COVAX facility, no? If they ask about COVID, sorry?
Not much.
Right. So COVAX is basically this. Now, these vaccines are highly, this is a very brief idea, right? These vaccines are highly sort of, you need money to get these vaccines. So these middle income countries, or say for low income countries and middle income countries, it's a financial burden. It's an added burden that you have to take such amount of vaccines to prevent COVID, right? So, what few organizations, for example, Gavi is a non-governmental organization where they strive for improvement of vaccine availability, right? They work for vaccine availability. This Gavi, and there's another organization called CEPI, CEPI, right? Then the UNICEF. These three organizations, along with the WHO, get together and form a coalition called COVAX, right? So what they do is, what their objective was, development, production, and equitable access to COVID-19 vaccines. Equitable access, right? So even though you are poor, you have your fair share of vaccinations from the production, right? So development, production, and equitable access to COVID-19 vaccines. That is their objective, right? So this alliance, what they do is they will give an advanced market commitment, right? They will tell these low income and middle income countries that we are financing for your this amount of vaccination. For example, they will finance 20% of coverage for their entire population, right? Vaccine coverage, 20% of COVID-19 vaccine coverage for their entire population. So Sri Lanka is also a part of this COVAX. As you can remember, we received some COVID-19 vaccines through COVAX facility as well, right? So their target was to distribute around 2 billion doses by end of 2020, right? Previously, that was their target. Still, they are distributing vaccines. So remember it as a coalition for development, production, and equitable access. They ensure equitable access of vaccines without any discrimination, right? Where if they ask about in a short note or something like that, just remember about COVAX as well, right? Okay. Have you gone to this determinants of immunization schedule for a country? Samsa kala de tika. Determinants of principles of determining immunization schedule. Etik kala.
No, no. That
No,
means
that is important. Ek podda note down කරගන්න කලේ නැත්නම් ඒකෙන් අහනවා. හරිද? They will ask from that. Normally they ask, right? ඒක වහලා අහන්නේ. So what is this is principles of determining make a EPID. This is available in EPID website as well, right? If you go through the EPID website, it is available, right? Principles of determining these immunization schedules. First of all, the first criteria is age specific risk of that particular disease. First take the age specific risk. First one is the age specific risk of that particular disease, right? The second one is age specific immunological response to vaccines. Age specific immunological response to vaccines, right? Then the third one is, this is when you build up a immunization schedule, right? These are the things they consider: age specific risk of a disease, then age specific immune response to vaccines, then what is the protection provided by the maternal antibodies. The maternal antibodies වලින් cover එකක් දෙනවා නම් මාස 10ක් විතර වගේ යනකම් you don't need to introduce a vaccine to a 2-month-old child, right? 2-month-old child, right? So what is the extent of protection given by the maternal antibodies, right? Then age specific risk of vaccine associated complications. Immunization program එකේ ගන්න vaccine එකේ age specific risk එක complications වලට. Everything is age specific, right? Age specific risk of vaccines associated with these complications, right? Then the other thing is program feasibility. How feasible is to sustain this program, right? Then the final thing is youngest group at risk of developing this disease. Youngest age group. They will consider the youngest age group, right? So these are the criteria when they, these are the principles sort of determining the immunization schedule, right? It is available in epidemiology website as well. Huh? You can go through this as well. Right. In what about what else on vaccines? I will not tell you about these types of vaccines. Huh? You can go through it neither. Types of COVID-19 vaccines, they won't ask, right? They won't ask directly, but better to have idea. You know about COVID-19 vaccines now? Types? Better to go through these COVID-19 vaccines. And the other thing is, what about vaccines hesitancy? You can ප්‍රශ්නයක් එන්න පුළුවන් because it can they can build a question on vaccine hesitancy, then they can go for risk communication, they can go for different areas when they ask a question on vaccine hesitancy. So anyone can tell me three criteria for vaccine hesitancy. දන්නවද කවුරුහරි? ඔයගලන්ට කරාද that Rogers curve on vaccine acceptance? Anyone did vaccine or any other program? Curve එක laggards ලා, early acceptors, late acceptors එහෙම එකක් කළාද?
Yes.
Right. So read about that one, right? That is important, right? You can apply some of these, then they will surely ask. I think they will ask about this now. There's a problem with this vaccine acceptance in the third wave, no, right? And the booster vaccination. So they can very easily sort of develop a question on this aspect. So you need to have some idea about vaccine hesitance, right? So to label a population as vaccine hesitant, or there is vaccine hesitancy, you need to have three criteria. 3 C's. Remember it as 3 C's. First C is complacency. Complacency means now you are not considering vaccination as a priority. Now your vaccine center, your MOH is just next door, right? There are availability of vaccines, right? But you don't go there and take the vaccine because you don't consider it as a priority. So that is complacency, right? When you have complacency, there can be vaccine hesitation, right? Then the second one is confidence. You don't have the confidence. Now you have heard about stories where the people come with a chip and they inject the chip into your body, right? Then then another one tell that after vaccinating the third dose, you will get a high fever, you get body aches. So you are not sort of confident to go and take the vaccine. So that will create vaccine hesitance. First one is complacency. Second one is confidence, right? The third one is convenience. Now, you expect the vaccinators to come to your home and vaccinate you. එහෙම වුණොත් ඉන්නවනේ ගෙදරට වෙලා ඉන්නවා කොහෙන් හරි කඩම් පාත් වෙලා මේක විදලා යනවා. Right? That is called convenience. You expect convenience. ඔයාට ගිහින් පොලිමක ඉන්න බෑ. You can't stand in a queue for 1 hour and get the vaccine. You need to go there, then within seconds you have to get the vaccine and come. So those are the people who seek convenience, right? So if you have complacency, if you have confidence, lack of confidence, and if you seek for convenience, then that 3 factors will create hesitance. So if you asked why do you think that people are not coming to get the third vaccine of third dose of COVID-19 vaccine, you can very nicely write these 3 factors. These are the globally accepted 3 factors: complacency, confidence, and convenience, right? And there are other factors as well, but these are the basic very important 3 factors, right? There can be delay in acceptance as well, no? There can be delay in acceptance as well, then refusal to vaccinate as well, right? That depends on various factors. But vaccine hesitancy, if they ask about vaccine hesitancy, these are the main 3 factors, right? So think about how you can avoid these factors as well, right? If they ask about the vaccine hesitancy, they will definitely ask how you, as a MOH, right? In your MOH area, where the booster dose vaccination is coverage is around 20%, right? They will ask what are the factors that can be contributing to this low vaccine acceptance. Then you can write on these lines as well, right? Then the second part of the question will be, what are, as a MOH, what are the interventions, right, that you should initiate to increase the vaccine coverage? කියන්න බලන්න එකක් දෙකක්. කොහොමද කරන්නේ? We have MOHs නේද who have experience in MOH.
Quiz awareness.
Yes, one is awareness, but you have to sort of you can't write like community awareness, right? You have to elaborate it a little bit. How you aware, right? How you create an awareness program. What else?
Surveillance system.
Yes. Now surveillance system sort of now you can get an idea about now if you have a proper surveillance system now this then ඔයගොල්ලන්ට කියනවා 120ක් තමයි MOH එක ඇතුලේ vaccine acceptance එක තියෙන්නේ කියලා. But there can be as you rightly said, if you have a surveillance system you can identify the areas where there is what are the pockets in your MOH where there is vaccine hesitancy or where there is low coverage, right? To identify that, you should have a proper surveillance system, right? This surveillance can be formal as well as informal, right? The formal surveillance, you have all these data from PHIs, PHMs and all, you will get a feedback. And what are the informal surveillance systems? Rumor surveillance. Now there's a rumor going on within the community that this particular group of people are not coming for vaccination, right? So there can be rumor surveillance as well, right? So having a proper surveillance system and getting down the information from the community is one other thing. Awareness is one, right? Then for awareness, I mean, what are the people that you can request help?
Advocacy of the leaders.
Right. Yeah. Advocacy. Yeah. Right. Even that advocacy, you have to elaborate, right? So advocacy now, you can target different people, community leaders, right? Faith leaders or religious leaders, then youth organizations, right? That depends on the data you have at your hand, right? From your surveillance system, you have identified the age cohorts. What are the age cohorts that there is less vaccine acceptance, right? What are the areas where there is less vaccine acceptance? Then you prioritize your awareness onto that key areas, right? Other thing can be now other line to complacency, confidence, and convenience. Some people may accept convenience as well. Now your MOH, for example, the GN which is furthest to your MOH office, they have to travel for 1.5 hours to get into your MOH, right? So that is very inconvenient. No, for example, for a daily laborer, it is very inconvenient to come to your MOH for 1.5 hours or 1 hour. This is example, right? So rather than they come into your MOH as a good MOH, what you can do is you are going there with the vaccines to their community. So you can have a discussion with your stakeholders. For example, you have these armed forces supporting you, you have these Pradesh Sabha people supporting you, you have these divisional secretary people supporting you. So your intersectoral collaboration, your stakeholder mapping has identified different stakeholders that are valuable in such instances. So rather than people coming into your MOH, with the approval of the regional administrators, you can go to their place or their clinic or their PHM's office and initiate the vaccination program. So those kinds of things you can clearly write, right? So that is how you have to write.
Field vaccination.
Sorry?
Is it a field vaccination like that?
Field vaccination, like field vaccination, right? And what is the other thing? What is the other thing we deployed during this booster dose?
Through the media, giving the correct information.
Right. That is one accept as well. Now, if your surveillance system identified that there is misinformation, disinformation, or malinformation, disinformation, misinformation, and malinformation, they can ask them. Just see what are the differences: misinformation, malinformation, and disinformation. Misinformation, disinformation, and malinformation, right? So there are those kind of information. You can clearly identify what are the problems, what are the misinformations going on, and you can address them through media. That is very correct, right? The other thing is mop-up campaigns. That means you organize a campaign where anyone can. Now, irrespective of their PHI area, irrespective of their PHM area, irrespective of their age, they can come to the MOH or a specified area and get the COVID-19 vaccine. Right? You can organize such vaccination campaigns as well, special vaccination campaigns. Right? So develop your answer like that. Okay. Any questions? You know about these differences, neither? Have you gone through these differences? This risk communication part එක කවුද කළේ?
Priyanka madam.
අද?
Priyanka madam. Priyanka Ransin.
ප්‍රියංග මැඩම් කරන්න නැතිනේ misinformation, disinformation. ඒ ටික කළාද?
Can you little bit elaborate on that?
Yeah. Now the there are three kinds of false information, right? There are basically three kinds of false information. First one is misinformation, right? Misinformation is basically misleading content, right? False connection. There is no connection between the story, between the lines of the story. Misleading content, right? Now this misinformation, they basically, now say example, now this is example, right? Now you have a very technical detail to be tell to the people. For example, in vaccination, you have to tell about the vaccine side effects and all. Then the Pradeshik Sabha Mantri comes to the media interview and he keeps on telling about this COVID-19 vaccination, complications, right? So he will definitely, because he lacks the knowledge around, because he lacks the knowledge about these vaccinations, he will give misleading content, right? So this is misinformation, right? ඒ කියන්නේ දන්නේ නැති එකෙක් මොනවා හරි ගිහින් කියවනවා බොරු තමයි කියන්නේ. So this can be misinformation, right? Then disinformation is manipulated content or fabricated content. මේක හිතලා කරන්නේ, right? This is intentional. They manipulate the content, they fabricate the content. For example, now for Pfizer, they have say they have identified swelling of the arm as a side effect of the Pfizer vaccination, right? But these people go to the media and tell, they manipulate the content, they fabricate the content, and they will say there will be total malfunction, or there will be sort of a neurological complication due to this Pfizer vaccination. So that is disinformation that will harm the people, right? False context, manipulated content, fabricated content, right? Then malinformation, right? That is the most dangerous thing, that targets a specific group or target a specific person. For example, now there's a very well-known eminent scholar on vaccinations. Then these people target that person. එයා කියපු විදියට බොරු දාන්න. There's a scientist that is well renowned for these vaccinations, and they go and publish data that this scientist is telling within 5 years of this vaccination, people will die. So that is malinformation. That is with the intention of harming someone, you spread the false news, right? So that is malinformation. So in your answer, if they ask how you can sort of develop a communication package to improve vaccine acceptance among community, you can clearly tell, I will address misinformation regarding vaccination, that is false misleading content. Then disinformation regarding vaccine acceptance, that is fabricated or manipulated content. Then malinformation, that is harassment or targeted hate speech or targeted campaigns against vaccination. right? So these are the basic differences between misinformation, disinformation, and malinformation. So this is what infodemic is. Now, anyone, Priyanka madam, I think most probably she has done infodemic, right? Infodemic color.
Ultimate one, disinformation and misinformation are equal.
No, not equal.
Both are with the intention.
No, disinformation is not with the intention targeting a specific individual or a specific organization. That is the difference, right? So these conspiracy theories, these are disinformation. That's as a general. They are not targeting anyone, but they are fabricated and deliberately manipulated information, right? But it's at a larger scale. But this malinformation is they are deliberately targeting. Okay.
Yes.
Right. So infodemic is this malinformation, disinformation, and misinformation is part of this infodemic, right? Basically, infodemic. What is infodemic is, now we have we have thousands of ways of getting information, no, regarding the COVID-19, right? So there is a overload of information, right? So it has become an epidemic itself. There are many information. People can't clearly identify whether these are false information or true information. They lack the technical skills to do that. So it will become an epidemic. So that is infodemic, information epidemic. The question can be asked from that 10, right? Because the last time they asked from how you identify and sort of create a communication campaign. Now this time definitely since these vaccinations are going on and so forth, they can ask about this infodemic as well. Read about infodemic. There's a now there's a different sort of school of thought on infodemic as well. Many resources. Just type infodemic WHO, then you can get all the details. Right? See about this infodemic. Okay, any questions? Any questions on that thing?
No. All right.
Sorry? Right now?
All right. Yeah.
Yeah. Okay. Any other thing you need to know about this vaccination and COVID-19? Have you gone through these weekly epidemiological reports in website?
Yes.
ඒ ටික කියවන්න, right? ලොකු වෙලාවක් යන්නේ නැහැනේ, at least past 10 or 15 weekly epidemiological reports කියවා යන්න. Most of the questions they will draft through these weekly epidemiological reports as well. That is what I did. I read the last one was 20 July, right? Then read up to that one. I read about 15 to 20, right? So there were during the COVID time there were weekly epidemiological reports on NCD and COVID-19, mental health and COVID-19, occupational health and COVID-19, right? Those kinds of epidemiological reports, just have a look, right? I'm not going into detail, but better to see about this, how this NCD program sustained during COVID-19 outbreak. Anyone of you have idea about how this NCD program sustained during the COVID-19 outbreak? Points. Now you have your NCD program. We have our NCD program, and we can change it to other things as well. How this NCD program was sustained during the COVID-19 outbreak. if they ask a question, how the NCD program, non-communicable disease program, was sustained during the COVID-19 outbreak, what you will write?
Delivering the essential drugs to the hospitals.
Right. Yeah, that's a good point. Right. Then what else? Now, first of all, when they ask about that kind of a question, you must think about that assessment, rapid assessment, right? Now you have COVID-19 outbreak. On top of that, you have people with chronic diseases and NCDs that they need to have their drugs at any given moment, right? So you have two compound problems, right? So how you prioritize these problems and how you prioritize the solutions for these problems, you should have, first you should have a rapid assessment of the situation. Now in this case, now people can't come to NCD clinics in the hospitals, right? People can't go to their nearest pharmacy, right? People can't go to their private practitioner, right? So there are issues with service delivery now. So first, you have to have a rapid assessment of service delivery for NCD. That's the first thing. Rapid assessment of service delivery, right? Then prioritize the essential services that can be delivered during the COVID-19 pandemic in respect to NCD services. Prioritize the services. Again, අපේ තියෙන pressure බලන program එකක් තියෙනවා. BMI බලන program එකක් තියෙනවා. Drugs, essential drugs බෙදන program එකකුත් තියෙනවා. We have our program to measure BMI within the NCD program. We have a program to deliver drugs. Now, out of these two, what you prioritize? What you prioritize? BMI බලන එකද prioritize කරන්නේ, බෙහෙත් දෙන එකද prioritize කරන්නේ? බෙහෙත් දෙන එක. You have to prioritize the delivery of drugs first. So you should have to you have to identify the priority, right? First you do a rapid assessment of the service delivery, then you prioritize the problem and prioritize the solution, then move forward. අන්න එහෙම පොඩ්ඩක් ලියන්න පටන් ගන්න. එකපාරට දැන් ඔයාගේ උත්තරේ හරි මල්ලිය. දැන් එකපාරට හැබැයි ඔයා එහෙම කිව්වොත් දැන් your answer is correct. They started distributing drugs through the postal service, but you have to have some value addition to your answer, right? You go from start from rapid assessment of service delivery, right? බරසාර වචන ටිකකුත් දාන්න එපා. එතකොට නේ අර තේරෙනවා කියලා දන්නේ. You rapid assessment of service delivery first, then priority of the services, prioritization of the services. Out of that, we prioritize the essential delivery of essential medication to NCD patients, right? Then you prioritize the areas which you can deliver. For example, prioritization of the clinic-based care for drug distribution. අපි prioritize කරනවා මෙන්න මේ identify කරපු clinic වලින් තමයි අපි drugs ටික distribute කරන්නේ. දැන් එහෙම identify කළානේ within the CMC area, they identified different clinics where the people can come to that clinic and get the drugs, right? ඊළඟට මොකද්ද? ඊළඟට consider reorganization of services. දැන් අපේ තියෙනවා cancer service එක, cancer registry එක, හරි cancer identification service එක, NCD වලට සම්බන්ධයි, right? So now there are difficulty in accessing people. So we reorient the program. අපි වෙන විදියකින් ඒක orient කරනවා. Through online programs, through MOHs we implement, right? So we reorient the services. That is the word. We reorient the services. Okay. Right? Then what you have told. Now, using innovative ways to deliver the drugs. For example, through postal service. Right? And then the other thing is opening up of pharmacies during identified days and creating a list of pharmacies where you can get the drugs. Then other thing is, what is the other thing? Issuing drugs for more than 1 month. මාස 3කට විතර එකපාර issue කරනවා, right? Then allowing private the drug prescriptions which were written by the private doctors or GPs to be taken from the hospital clinic. Right? So you can write it as such, but start off with the assessment, right? Start off with the prioritization. Unable. What else they have done? You can write community-based outreach campaigns, then guideline developments. They have developed guidelines now. Anyone associated with the NCD unit, they can remember, I think. They have guidelines. They have several guidelines for their purposes, right? Then social media campaigns, right? Behavior change communication, NCD surveillance strengthening. All these stuff were done during the COVID-19 pandemic to reorient health services, reorient the NCD services to cater for NCD patients during the COVID-19 campaign. Got it? හරිද? අන්න ඒ විදිහට පොඩ්ඩක් හරවලා ලියන්න. Okay. This can be I mean this can be deployed in other areas as well. දැන් ඩෙන්ගිත් එක්ක ඇහුවත් ඒත් කියන්න පුළුවන් ඔය විදිහට. Okay then.
Right. Okay.
ENOH balagana ENOH, there was a last time question, no? ENOH and COVID-19. Ekina da medapara dena ekak නැති වී කියලා මට හිතෙනවා, but better to have an idea, right? How they have these created workplace guidelines. What is the bubble concept, biobubble concept? You know about the biobubble concept, no?
Yes.
Right, biobubble concept. Then how they have declared several categories to come to work and not to come to work, right? Then this dream concept, how they have implemented dream concept. Then the dream plus V concept, right? All those things, right?
What is that?
Right.
Dream plus B?
Dream means now D for distancing.
Yeah. Dream.
You know,
Yeah, the dream plus B or something.
plus V means vaccination.
Okay. Okay.
Right? The latest one is dream plus V, no? V is vaccination. Right. Then look about these mental health aspects during COVID-19 vaccination as well. Huh? Not vaccination, sorry, COVID-19 time, these mental health aspects as well. There's a WER specifically on that, how this gender-based violence was increased, right? What about this social stigma, right? Social stigma because they can ask from that one. That has been never touched. Social stigma they have never touched.
They ask like how can we reduce a social stigma? Like
How can we?
As a MOH, how can we address the social stigma in the duty?
Right. They have asked.
In the factory worker, how can you like in the workers? Yes.
If they ask, you mean you asking if they ask how can you prevent social stigma?
Yeah. Last time there's a question.
There's a question, right? Okay. So look about I'm not going into detail of these things, but just have idea on these aspects as well, right? So shall we move on to dengue then? We are running out of time. If you are okay, I am okay. Now it's 11. Dineshan, මොකද මල්ලි කරන්නේ 11 වෙලාව. Disaster management උත් තියෙන touch කරන්න. Is it okay with you guys?
Yeah. Shall we do disaster management and go to dengue?
Right.
Okay.
Yeah, that's okay.
Right,
That's
okay.
fine. Right. Okay. Now in disaster management, basically there's an equation that you have to remember. If you remember this equation, then you can answer any question from disaster management. You know the equation. What is the equation for disaster risk? For risk, basically.
Vulnerability into risk.
Sorry.
Hazard into vulnerability divided by capacity.
Right. Yeah. That's the equation, and you have to add exposure as well, right? So disaster risk equals hazard into vulnerability into exposure divided by capacity, right? So if they ask any question on disaster management, write this equation at top of your paper and think along that line. Why I am telling that? Now, to be a disaster, you have to have a hazard. No, hazard means a potential to create some negative aspect. Now, for example, they have done it. Who did it? Shankar madam.
Yes.
Disaster management.
Yes.
Right. So for example, now you have a large boulder or a large rock on top of your in the top of the mountain just beside your house. Now this rock can be dislodged, this boulder can be dislodged at any time. So it's a potential negative consequences that is waiting to happen. So that's a hazard, right? So that can be applied into any disease as well. Now COVID-19 is a hazard, right? Now, what about vulnerability? Now, when you have consider people living around in Modara Mattakuli area on urban slums, right? Then consider people living around in Kurunduvat and Maitland Avenue and all those areas. Right? Now, who are the most vulnerable people there? The vulnerable people will be the urban slum people. Why they are vulnerable? Now they have very many reasons for their vulnerability, right? They have very poor socio-economic conditions, right? They are living in very sort of limited area, right? They have different kinds of diseases, right? So if you have social vulnerability, if you have economic vulnerability, if you have physical vulnerability, the chance of getting a hazard is high, right? So if your vulnerabilities are high, you have more chance of getting into a disaster or more chance of having a risk, right? So you can have different kinds of vulnerabilities. That can be physical vulnerability, that can be economic vulnerability, that can be social vulnerability, right? So you are vulnerable than the other people. Then the exposure level. Now, for example, a house situated directly below that rock is more exposed to this rock than a house situated 20 kilometers away from that rock. Right? අර ගලක් පෙරලෙන තියෙනවා කන්දක් උඩ කෙලින්ම ගල යට තියෙන නිවස exposure එක වැඩිනේ. ඒ hazard එකට. ඊට කිලෝමීටර් 20ක් විතර තියා එහා තියෙන ගේකට වඩා. Right? So the exposure part is also there. Right? So you have vulnerability, right? You have hazard, you have vulnerability, then you have exposure. Now, your risk is high if you have high hazard, then your vulnerability is high, then your exposure is high. ඒක COVID-19 වලට apply කරන්න පුළුවන්, right? It can be applied anywhere. Now, if you can apply it to COVID-19, now you have the COVID-19 virus, say a mutation, right? You have the COVID-19 virus, then you have the vulnerable people living in poor socioeconomic areas, then they are exposed to that particular disease because they are living in very close quarters, right? So your risk of getting infected with COVID-19 will be high, right? Then you have your capacity. Now, even though you are poor, right? Even though you are living in a very poor socioeconomic background, and even you are exposed to this COVID-19 infections due to you are living in these close quarters, if you have been vaccinated by all 3 doses, then your chance of getting this disease and going into complications is less, right? So your capacity is high. So the risk of getting this disease will be less. Now, if your capacity is high, your risk will be reduced. That is, it is inversely proportional. If your capacity is high, your risk is less. If your hazard profile is high, if your vulnerability is high, if your exposure is high, then your risk is also high, right? ඔන්න ඔය විදිහට ඕක මතක තියාගන්න. ඕකෙන් ඕනම මේ එකකට apply කරගන්න පුළුවන් disaster management වලට ආපු. Right? Right. Then they can ask now, sort of now, For example, now if they questions දෙක තුනක් නිකන් example වලට කියන්න. දැන් මොකද මේ theory කතා කරලා වැඩ නැති නේද? Just this theory, because you have to have an idea about this risk, then the hazard, vulnerability, exposure, and capacity. Right? Now, for example, now if they give a question like this, Dineshan, මට share කරන්න පුළුවන්ද screen එක?
Yes, you can share it.
All right. Just give me a second. Can you see the screen?
Yes, we can see it.
Right. Then when මේ වගේ එකක් දෙන්න පුළුවන්. Now they can give something like this, right? Question. Now, for example, now DGHS has instructed your hospital director to convert your hospital to a COVID-19 treatment center on an emergency basis, right? So he has advised the director to prepare the hospital to cater for 200 COVID-19 patients. Now, this is a real scenario, no? During the COVID-19 second wave, right? So they just asked. Now DG put the orders to the PD, and PD put the orders to the RD, and RD just asked the hospital director to convert this hospital to a COVID-19 hospital, right? But in your hospital, you has only 150 patient beds, right? Your hospital has only 150 patient beds. Now you have been asked to cater for 200 COVID-19 patients. Then you have 3 ICU beds, you have 1 consultant in each major specialty, and you have 2 ambulances. Now, say example, now you are the medical officer in charge of OPD or something like that, or you are the SMOPD, right? You are the second in command. Now your hospital director has asked you to convert this hospital into COVID-19 facility, right? So what are you going to do? These are the disaster management questions that they can ask from these scenarios. What are the priority areas you should focus now?
First, we should manage the reserve the emergency area,
Right.
and the OPD,
Right.
and a transport service to the nearest hospital for the
Right.
critical patients.
Mhm.
Those for the normally coming patients,
Right.
and then can reserve 1 ward for a as a daycare unit, and we can separate that daycare ward into 3 sections as male, female, and pediatrics, and can manage with all specialties inside that one.
Right.
And then the rest of the area can be converted into the COVID hospital. And as in earlier stages, we have to separate the area from the normal patient area because of to prevent the disease and reduce the stigma of the patients normally coming to the OPDs. And
Right. Yeah. Go ahead. Yeah, I think you have covered almost everything. Yeah.
Then we have to increase the facilities inside the hospital for the patients, and we have to consider about the these waste disposals and the meals for the patients. So for that we have to increase the capacity of the kitchen, and about the sanitary facilities, we have to look after those things. Any renovations, we have to maintain it, a proper water supply for the patients, and proper and continuous water supply for the patients, and we have to allocate a recreational area for the patients for earlier time, they have to spend about 10 days. So if
Hmm.
they were inside the wards, they will get mental health problems.
Hmm.
And proper communication systems. And we have to, then we have to educate and aware our staff about the COVID situations and how to prevent and how to wear the PPE and
Right.
those things for the patients. And
Right. Yeah.
about the logistics also, we have to think about the proper continuous incoming of the PPE and other services also.
Right. Yeah, you have basically covered everything, right? Very good. I think you have covered basically everything. Practically, what we have been doing during the COVID-19 period, right?
Yeah.
But now they have asked what are the priority areas you should focus. Now, when you develop your answer, the important thing is you have to have some structure. Now, now when they correct the papers, they see about the structure. Now, you have clearly said all the necessary areas. But the improvement should be now you have to have some structure, right? So now what is the main problem identified in this one? Now your hospital is only one. They are only having 150 patient beds, right? But your director is asking you to renovate or convert this hospital to cater for 200 COVID patients. Now, within that instant itself, there is a mismatch, no? Right? Hospital has only 150 beds, right? They have asked you to cater for 200 COVID patients, right? You on top of that, you have your normal patients as well, right? So there's a mismatch, right? So what you should do is to identify the key priority areas. You should have a risk assessment, right? See whether your hospital is having a proper risk assessment, earlier prior made risk assessment, right? In this risk assessment, what you should know is you should have a special emphasis on your capacity, right? Why capacity? There's a mismatch of capacity. You have been asked to cater for 200 patients and you have only 150 beds, right? You have only 2 ambulances. You have only 3 ICU beds, right? So your first priority will be to have a proper risk assessment to identify the priority areas, right? Then see whether your hospital has an institutional preparedness plan for these kind of emergencies. Now, some of the hospitals having these institutional preparedness plan. කියන්නේ මේ වගේ එකක් આવොත් hospital එකේ capacity එක scale up කරන්න වුණොත්, if you are to scale up the capacity of the hospital, whether you have institutional preparedness plan, then you will go through this institutional preparedness plan. Then identify whether I can deploy this institutional preparedness plan for this scenario as well. එහෙම නැත්නම්, what are the additional resources you should identify, right? අන්නේ additional resources එනකොට තමයි ඔයාර කියපු ඒවා ටිකේ ගොඩ වැඩි ප්‍රමාණයක් එනවා. You should acquire some physical resources, you should modify some areas, right, to cater for the COVID-19 patients. You should acquire some of the human resources, right? You should have a proper communication plan with other hospitals for transfer and referral of patients, right? Right? So special modifications as well. What are the special modifications you should consider? For example, a fever corner, triage facilities, isolation facilities. Then you should have idea about the critical infrastructure. What are the critical infrastructure? Your water, your electricity, your power generation, right? Your waste management, as you correctly said, right? So you should have a plan or a modification plan for these areas as well. So these will be your priority areas. You should first have a risk assessment where you stand, right? When you write disaster management answers to disaster management questions, this is the format that you can use, right? A risk assessment. You assess your risk, right? Then in this case, specially assess your capacity, right? Then institutional preparedness, whether we already have a plan, whether we already have something in writing, right? If not, how we can make a new one. If we are having one and we can identify several gaps in that plan, how we can scale up, right? And එතකොට තමයි අර ඔයා කියපුවා points ටික ඔගේ ඇතුළට තමයි ring ගවන්න. Then acquiring additional human resources, physical resources, right? Communication pathways. Then special modifications. Phone එකක් දානවා, triage කරනවා, isolation දානවා, critical infrastructure ගැන බලනවා. Then finally a contingency plan. What is a contingency plan? If all these measures fail, now for example, your hospital director has advised you to build a 200-bed COVID-19 patient hospital, no? Then suddenly on your area, this is the only hospital and there are around 250 to 260 patients that are needing inward care. Then what? Then how can you scale up? Then you should have some contingency plan. Contingency plan can be improving the facilities within your hospital or transferring patients to another hospital with the agreement of the RDHS or PDHS, something like that. So you should have a contingency plan as well. And structural, right? All those answers are correct. You have basically covered all the areas, but you have to structure. Right? Is that okay?
Yeah. Yes.
Right. Now this is another scenario that in disaster management they can ask. Now normally they don't ask about this camp management and stuff. You have all the notes neither about camp management. Everything, you know, the notes.
Yes.
Right. Normally now itself they don't ask about these the camp management and all directly, right? They will put it into different context like this. Now the most preferred sort of area in disaster management these days is compound disasters, right? All the big fellows who are preparing disaster management questions for your paper are very much like to have about these have an idea about these compound and cascading disasters. What are these compound cascading disasters? Compound and cascading disasters basically they are multi-hazard scenarios. Now you have COVID-19, on top of that you have a dengue outbreak, right? You have COVID-19 and on top of that you have a dengue outbreak. Then you have a COVID-19 hospital facility. Then suddenly a flood comes in and this hospital is flooded. Then that's a multi-hazard. You have COVID-19 as well as you have dengue. You have COVID-19 as well as you have flood, right? So how you can manage this, right? So for example, now look at this one. Your hospital has been converted to a COVID-19 intermediate care center with a bed capacity of 100, right? Your hospital is situated in a floodplain and vulnerable to seasonal floods, right? With the torrential rain in past few days, your hospital is at risk of flooding and ministry has instructed you to evacuate. Do you agree with the ministry decision? Give your reasons for your decision. If you decide to evacuate, list 5 priority actions you should initiate as a disaster manager, or say as a now you can also apply this to your MOH as well. Do you agree with this ministry decision?
Yes. Yes.
Yes.
Yes.
Right. What are the reasons?
If we wait until the flood comes, there will be a big problem because patients cannot be transported in a normal way.
Right. How you come to that conclusion? දැන් අපිට දැන් මිනිස්ට්‍රියට ලියලා දැන් අපි yes කියලා කියලා හරි මිනිස්ට්‍රියට අපි රීසන් එක මොනවා හරි ලියලා යවනකොට we can't say අපිට මේ transport කරන්න බෑ එහෙම කියන්නේ නැහැ. We have to have your point is correct, but you have to give some rationale in it. You have to prove yourself. How you prove?
Risk assessment.
Risk assessment is one, right?
The capacity of assessment of the transport capacity.
Right. And what else?
And hazard is high.
Right. So basically all your points are correct. Now when you write the answer, now Basically, this it should be like this. Now, to evacuate, right? What decision to evacuate, right? You should have a, as you correctly said, a risk assessment, right? You should look into the historical events as well. Then make a hamadam, for example, say Deniya Hospital, Deniya Base Hospital, hamadam para right? So it's sort of a normal event for these people. They know how to manage when there's a landslide. They know how to manage when there's a flood, right? So first of all, you should have a risk assessment, very correctly said. Then look at the historical events, right? Whether this has been a problem to your hospital for a longer time, right? Then the status of your patients, what kind of patients you have, right? What kind of staff you have, what kind of equipment you have, right? So those are the kinds that you should consider. What justify historically there has been major floods in history of this hospital, and hospital has been inundated. We have several critical patients. We have staff that has to be mobilized. Then we have equipment that are very sort of very expensive and can be damaged due to the flooding. That is why we are evacuating, right? You have the rationale. And the other thing is political and public pressure. Now, public is saying to evacuate. There can be a flood. People are saying from all around the hospital and in the community, they are saying, and the political leadership is also saying that you should evacuate. Then you should consider that aspect as well. Otherwise, just in case you, in good faith, you will stay at the hospital, but there can be few deaths due to flooding, then the blame will come to you, right? So that is to evacuate, right? So what is the, if you tell the answer like no, what is the rationale? That is, you tell that you have a contingency plan. You have already anticipated that this hospital will be flooded. So you have a contingency plan, right? You have some guidelines, you have some protocols, you have some SOPs on service delivery during a crisis, right? You have your surge capacity. What is surge capacity in disaster management? Surge capacity means you have a threshold level, right? Beyond that threshold level, you can manage some to at a point, right? You have the threshold level, that is the maximum tolerance level. But since you have some other facilities and other resources, you can manage a little bit beyond your normal maximum capacity. That is your surge capacity, right? So you can't go beyond your surge capacity. You have to evacuate. That is the point where your all resources are exhausted, right? And what is not to evacuate, and public relations also can be taken as a point, right? So that is how you build your answer. Now, what are the priority actions you should take if they ask? Who should be evacuated first? How to choose this evacuation criteria? I mean, how to choose patients, where to evacuate, how to evacuate, and what if all go wrong? You should have a contingency plan, right? So this is how you can apply disaster management, the theory, into questions, right? It's a compound disasters can be then also they can ask, now in your MOH area you have COVID-19 patients, on top of that you have dengue patients, right? But you have been noticing that people are not these dengue patients are not visiting to hospitals purely because of the stigma associated that if they come to these hospitals, they will contract COVID-19 as well. So how you manage this situation? COVID-19 patient dengue patients have dengue patients hospital treatment hospital COVID-19 headache. How you, as a MOH, how you should manage this situation?
Doing a situation analysis and identifying the high risk area for the dengue in the MOH area,
right?
And conducting the awareness campaign among these people, and arranging some service delivery to the fever patient, to the checking full blood count and those things by the nearest GP.
Right. Yeah, those are correct. Now, ඒක අර පිළිවෙලකට ඒ කියන්නේ එක point එකෙන් point එකට පිළිවෙල ලියන්න. Now, as you correctly said, you have to have some situational analysis where the dengue patients are, right? What are the hotspots for dengue, right? Then you have to see why these people are not now they are telling that this is due to stigma, but there can be many other reasons as well, right? When you see a problem, especially like issues like dengue and COVID, right? You have to have some idea about the community perception. How you identify community perception, right? You can see whether they know the severity of the disease. That is the first point. මේ මිනිස්සු දන්නවද මේක කොච්චර භයානකද කියලා. For example, dengue, whether they know how severe is the disease. Then the other point is whether they know how susceptible are they. ඒ කියන්නේ මේ disease එකෙන් හැදෙන්න ඒගොල්ලෝ කොච්චර susceptible ද, vulnerable ද කියලා ඒගොල්ලෝ දන්නවා. You should have idea. Then what are the barriers and enablers for them to come to hospital? මොනවාද ඒගොල්ලන්ට hospital එකට එන්න තියෙන barriers, ඒ වගේම facilitating factors, right? So you should have some idea about that one as well, right? Next thing is what are the people around that particular family or particular people are doing, whether peer support, peer pressure is available, right? ඔන්න ඔය කාරණා හතර, ඔන්න ඔය කාරණා පහ you should have a clear idea. Then depending on that one, you can build your awareness program. Now, as you said, this awareness program can be a community peer community campaign where you spread the message that this disease is dangerous. You have to have early referral, right? Then you can initiate it through general practitioners, right? You can initiate it to community leaders, faith leaders. Then from the hospital end, you can also say that as the MOH, this hospital is adhering to all the COVID-19 precautions, right? They have their isolation capacities, they have their separate treatment capacities for COVID-19. So you can reassure the patients that you are safe to go to that hospital. So what you do is basically you improve their health seeking capacity, right? So that is how they can sort of include the dengue question into a disaster management question as well. So that is how you answer, right? Now, since dengue is included, shall I ask a question like this? Now, now they will tell now. We have observed over several years the dengue cases are in a rise, right? They are rising, or they are increasing in magnitude as well as in frequency. But during COVID-19 pandemic, health authorities have detected a sharp decline in dengue cases. What are the reasons for that, and how you identify these reasons? If they ask a question like that, how you do answer? During the COVID-19 pandemic, there is a sharp decline of dengue cases. How you can answer? කියන්න මන්.
It can be due to several reasons.
Right.
One is due to reporting problems and surveillance problem.
Right.
And the other one is there can be a true reduction. And the patients might not presented and fever must have attributed to the COVID even, and patients might stay home.
Right.
Those things are the areas I'm going to discuss.
Right. Right. Yeah. Actually, they are correct. Now, they are very correct. Now, actually, that is what happened as well. Now, right. So first, there can be less reporting from the MOHs and sentinel hospitals, right? Why less reporting? Now they are overloaded with COVID-19 duties, right? They are overloaded with these vaccination campaigns. They are overloaded with contact tracing of COVID-19 patients. So the focus on dengue is much less compared to previous years. So there can be less reporting as well, right? That is the first one. Second one, as you correctly said, there can be a true reduction as well, right? There can be a true reduction as well. And if there is a true reduction, we have to investigate why there is a true reduction. That is second thing, right? Now, all of you know that basically this dengue in previous years, it's basically an urban disease. Now it has spread to all around the country, sort of have geographical extension of the whole country. But basically it was a urban disease, and it very closely associated with the migratory patterns of the people. For example, now a person who is working in a construction site in Colombo Municipal Council contracts dengue, and he goes to his native village, and the vector is available in the native village, and then the disease can be spread in that native village as well. So it is connected with the migratory patterns of the people. Now, during this COVID-19 pandemic, this migration was limited. No, there were mobility restrictions, right? There were isolations of several areas. So there was no movement from urban areas to rural areas to urban areas, right? And since there were lockdowns, people were confined to homes, right? This vector human interface, that means the chance of the mosquito to bite the human and spread the disease is comparatively less than the normal times, right? So you have your reporting issue, you can have a true reduction, then you can have the purely due to the mobility restrictions, there can be reduction of cases. Then due to lockdowns and all, people were confined to homes, so there is less chance of exposing into the mosquitoes during the workplaces and during the work sites. Then the other thing, on a positive note, since people were at home, they might have cleaned their environment as well, because they had ample time to clean their environment as well, right? You can write it as well, right? Source reduction right? So they might have done it as well. Then the other thing is, now the health seeking behavior, as you rightly said, purely due to the stigma associated with going to a hospital, they might have stayed home and we might have missed those cases, right? So we have several factors. There can be these positive factors as well as these negative factors, right? These can be the factors due to for a reduction in cases in dengue during the COVID-19 campaign. Right? Over the practical issues, right? ඊළඟට දැන් ඔයාලට තව ලකුණු ටිකක් වැඩිපුර ගන්න ඕන නම් දැන් ඔයාලට ලිව්වේ ඩෙන්ගි ප්‍රෝග්‍රෑම් එක ගැන පොඩ්ඩක් දන්නවා කියලා වගේ පෙන්නන ලියන්න කිව්ව හැකි. දැන් now you can write like this. Now there can be a variation in the climate pattern. Now all of you know that this dengue and all these vector-borne diseases are closely associated with what? Environment, closely associated with climate. Now in dengue, you have clearly two seasonal patterns, two seasonal peaks associated with monsoonal rains, right? We have our two monsoonal rains. No? So the dengue cases peak simultaneously with these monsoonal rains, right? So you can write, there can be a change in these monsoonal patterns as well. That can be contributed to reduction in dengue cases as well, or a change in the numbers of dengue cases as well. So that can be written. The other thing is what? Now dengue is a viral disease, right? So this virus, they have 4 types of virus, right? There are 4 dengue types. Now you can say there can be a change in the viral type as well. When there's a change in the viral type, that is normally associated with either reduction or increase of cases, right? And right? එතකොට සමහර virus type they have the epidemic potential. Others they have very less number of cases. So for the question why you think that these dengue cases are less during COVID-19, you can write it as well. Because no one has tested it yet, you can write it as an assumption. හරිද? ඔන්න ඕක තමයි ඔකට උත්තර ටික. ඕකේද?
Right, sir.
Right, ne? Right. ඊළඟට දැන් then another question that can be asked now. Now this has been asked in somewhere else as well. Now you are the MOH. මම දැන් dengue program එකට dengue they have done you the basics නේ. dengue අනෝජ මැඩම් කළේ. dengue basics ටික කළා නේද? dengue program එකේ basics ටික. Right. Then a question can be asked in this pattern as well. Now you are the MOH of dengue high risk area, right? So you have noticed that there's a gradual increase of dengue cases within your community or within some of your PHI areas, right? There's a gradual increase, right? Then the RDHS has also requested you to complete your COVID-19 vaccination within this week. Now your cases of dengue are increasing. As a MOH, how you manage your resources and how you initiate your prevention campaign for dengue? What are you going to tell? COVID-19 එක ඉවර කරන්නත් ඕන dengue cases ටික handle කරගන්නත් ඕන.
Doing a proper situation analysis and identifying the dengue high
risk area.
Dengue high risk and COVID-19 high risk area. And prioritize the place where both is high and while doing the vaccination on those places, at the same time providing this preventive and health awareness program on the dengue as well to the community using the same resources.
Right.
And at the same time.
Right. Now this very correct. We can situation analysis check you can do a situation analysis and identify what are the high risk GN divisions within your MOH area for dengue as well as for COVID, right? Now when you say a gradual increase of dengue cases, first of all you must compare with the historical data as well, whether this is a true rise, right? True increase of cases compared to last year, whether there is any increase, right? That will have effect on the cases as well. So you should have some idea on that one as well. Then as you correctly said, you have to initiate a proper prevention and control campaign. So you have to first identify what are the areas that dengue patients are coming and what are the places where dengue breeding is happening. That has to be identified. For that, you can do a vector surveillance program first, right? Vector surveillance program means you go to the field, right? You go to the field and identify what are the places where dengue mosquitoes are breeding. You do a spot check, right? Entomological surveillance, right? You do a vector surveillance or entomological surveillance to identify what are the key areas where dengue breeds within your PHI area. That can be a construction site, right? That can be a school. That can be individual homes, right? So you identify what are the areas where your dengue breeding is high. Then you prioritize these areas. Then you channel your resources only to these areas. Because why? You can't do a blanket program, blanket prevention program, because why? You have been also asked to do a COVID-19 vaccination program as well, right? So you have to divide your resources among these two areas, right? So to prioritize, what you do is you do a vector surveillance program. If anyone asks why you have sent 2 PHIs to this area rather than sending 2 PHIs for vaccination campaign, if RDHS asks, you can justify. I have done entomological surveillance, I have done a vector surveillance, and they have identified that this area has heavy dengue breeding. So they have a potential to form an outbreak, right? So I have deployed this number of people to this area, right? So you can prioritize the area, right? Then, as you correctly said, when you do the COVID-19 vaccination, you can mobilize the community, or you can do awareness program at the same time, right? When you do the COVID-19 vaccination, right? Now, consider say you are fully stretched, right? You are fully stretched on your program and you have to do a COVID-19 vaccination program as well. Then your cases, dengue cases are also increasing. You are having human resource deficiencies. Then better to write in your answer that you will call for help, right? You will ask your RDHS to give some human resource from the nearest MOH, right? You will be asking help from the others as well. So that will include some points to you, because you have identified that this is my maximum capacity. This will be exceeded in very near future. So I'll be requesting help, right? So that is how your answer has to be created. Okay then.
Yes.
Yeah.
Right. Then if you have been Dinesh and api time එක පැනලා, is it okay?
It's okay.
Right.
Yeah.
Right. So very few points. මම dengue වල තව points ටිකක් කියන්න. Now in dengue you have what you call integrated vector management, IVM, right? If they have not done it to you, just write it down. It's IVM, integrated vector management, right? Why vector management is important? Now all these vector-borne diseases, they have 3 basic requirements, no? So anyone of you know epidemiological triad? Definitely you must be knowing it. Someone tell me. Yeah, what is the epidemiological triad?
Agent, host, and reservoir.
Yes, agent, host, and the reservoir, right? So all these vector-controlled, vector-borne diseases fit into this model, right? So to control a disease like dengue, right, you should either control the vector, or you should either control the agent, or you should either control the environment, right? So there are 3 things. So for this, you have what you call an integrated vector management system, or IVM. So what are we doing in the IVM? Basically, IVM has several aspects, right? So first thing is IVM has a sort of control arm, environmental management methods. To control the vector or control the disease, you have environmental management methods. What are these environmental management methods? It can be 2: environmental modification, environmental manipulation. Environmental modification කියන මොනවද? දැන් අපි පීලි දාලා තියෙනවා. පීලි වල වතුර එක්කුතුනවාම ඩෙන්ගි පීඩ වෙනවා. ඒකින්ද අපි පීලි ටික අයින් කරනවා. Environmental modification. Environmental manipulation කියන්නේ අපි හිස් යෝගට් කෝප් එහෙම එළියට විසි කරලා තියෙනවා. අපි ඒව ටික අරගෙන විනාශ කරලා දානවා. manipulate කරලා දානවා. Right? So that is environmental manipulation. So first part is environmental management methods. Then to control vector, you have chemical methods. What are the chemical methods here? What are these chemical methods? These are larvicides to kill the larvae, adulticides to kill the adult. For example, fogging. Now dengue is closely associated with this fogging. So adulticide is also to kill the adult mosquito, you do the fogging. To kill the larvae, you do the larvicide. So that is the second method. Environmental management method then chemical method. Third method is biological method. What are those biological methods? You put guppy into water bodies, right? You put Bacillus thuringiensis bacteria, right? You put guppy into these ponds, right? So those are biological methods, right? So to control vector, dengue vector, you have environmental management methods, you have chemical methods, then you have biological methods. Other thing is you have your intersectoral collaboration and education, right? You can have different kinds of people. For example, Pradeshia Sabha. You can have the Nagara Sabha people. You can have the environmental ministry people. You can have the education ministry people. So all these people have to get together for dengue prevention. So you have the intersectoral collaboration and health education. Lastly, you have the law enforcement, right? There are some laws that will you have to have a fine if you breed dengue. So there are law enforcement. So by using these all 4 categories, you will be able to control dengue. Now, if you are being asked as a MOH, how you prevent or how you control a dengue outbreak from happening in your MOH area, you can very nice write like this. You deploy your environmental management methods, you deploy your chemical methods, your biological methods, then you go for your intersectoral collaboration, then the law enforcement as a last resort. Okay. හරිද? ඒක ගැන පොඩ්ඩක් බලා ගන්න. IVM එකට කියන්නේ, right? And the other thing is why dengue cannot be controlled after after so many years of these dengue messages, then after so many years of these dengue campaigns, why this dengue cannot be eradicated or not eradicated, sorry, eliminated or controlled per se? Why?
Due to epidemiological changes and seasonal variations.
Right, that is one point.
Urbanization, poor urbanization.
Poor urbanization. What do you mean by poor urbanization? You mean the urban built environment is not appropriate, right?
Yeah, poor urbanization around the country and
Right.
and people migrated.
Right. What else?
Adaptation of the vectors.
Adaptation of the vector. That's a very good point. Yeah. Now, if they ask about a question like that, you can basically divide it into 2, right? The disease itself, factors related to the disease itself, and factors related to the vector. Now, as you correctly said, adaptability of the vector to the environment is one factor that why we can't control it. And the climate factors and the environmental factors are favorable to the breeding of the vector. So that's another point why we can't control this disease. What are the disease entities? Now, this is a complex disease, no? Dengue is a complex disease. You can write dengue is a complex disease. We have, as in COVID, we have symptomatic patients, we have asymptomatic patients. Now, this asymptomatic lot is more than the, basically it's almost 90% of the cases are asymptomatic. Only 10% of the cases are symptomatic. So it is very difficult to identify these asymptomatic cases. You have to have a serosurveillance study to identify these things, right? So it's a complex disease. The other thing is but there are 4 viral types. Now, even though you are infected with one viral type of dengue, there is a chance that you can be infected with another viral type. So basically, theoretically, you have a chance to infected with dengue 4 times in your life, because there are 4 viral types. Then the other most important thing that you have missed, is there any definitive treatment for dengue? Is there any definitive treatment for dengue? There is no definitive treatment. Is there any prophylaxis for dengue? As in malaria?
No.
No. right? So there is no definitive treatment for dengue. It's all about early referral, fluid management, right? And proper observation. Since there is no vaccine, since there is no definitive treatment, it's very difficult to control. And the last point would be, as you correctly said, it is connected with human behavior and built environment. What is built environment? Built environment in the sense, the houses, the schools, buildings and all, right? It is closely related with the built environment as well as human behavior and mobility. So it's very difficult to control. If you write like that, if you do, in your answer, then you will get the maximum marks, right? And the other thing you should know about dengue is now, in dengue, now you have your targets. We have a target of reducing the dengue cases for dengue incidents for 100 to 100,000 population in 2023, and a case fatality rate reduction as well. Now we have been successful in reducing the case fatality rate. Why? We have improved our clinical management skills. We have improved our early referrals, right? Case fatality rate, but the incident is keep on rising. Why? Why? The answers are the answers to the previous question as well. Can make a control can make environment right? It's basically connected to the environment. It's basically connected with the human mobility. It's basically connected with the built environment, right? If you can tell like that, the answer is complete, right? Dengue walat oy tika danagathama, I think basically you are safe. And in disaster management, I forgot one thing. Please read about this safe hospital initiative. Have Priyanka madam done that safe hospital initiative? Right. Right. These are pet subjects of disaster management people these days. Huh? Safe hospital initiative means they will not ask you what is safe hospital initiative. It's a disaster management question, but they will ask how you can sort of prepare your MOH or prepare your local hospital to be safe from disasters. Now, Safe Hospital initiative is an initiative where you identify 3 areas in the hospital, 3 key areas. One is structural safety, whether your hospital is structurally safe to prepare for a disaster. Then non-structural safety. What are the non-structural safety? You can architectural safety. Architecture, whether it's disaster resilient architecture, whether your critical systems are functioning very well, right? That is the second one. Third one is the communication and the human element, right? Whether you have proper communication channels in case of a disaster, whether you have these human resources, whether you can function even during a disaster. Now, the basic idea of Safe Hospital Initiative by WHO is to continue the services of a hospital amidst a disaster. Disaster එකක් වුණත් hospital එක function වෙනවා. ඒකට ඒගොල්ලෝගේ structure එක හොඳට තියෙන්න ඕන. ඒගොල්ලන්ගේ critical systems ටික හොඳට තියෙන්න ඕන. ඒගොල්ලන්ගේ communication and human resources and functionality එක හොඳට තියෙන්න ඕන. Right? ඔය තුන තමයි මේ hospital prepare safe hospital initiative කියලා කියන්නේ. Right? Just read about it because they can bind it to COVID-19 and ask, right? Ask a question. Then read about this camp management. There are some calculations here. What number? What is the minimum amount of water needed for a camp and all? You can not take it. Just read on that one, right? Then what else you have? All 3 areas COVID-19. Dineshan, there was a question like this how these strategies were changed during all 3 waves. Right. Now, have you gone through this CCPSL position papers? I don't know. ලොකු වල රචනාවල් වගේ තුනක්. ඒ කියවද පොඩ්ඩක් නිකන් උඩින් හරි. ඒක පොඩ්ඩක් කියවන්න. හරිද? දැන් ඒක ඇත්තටම මෙහෙමයි. දැන් ඔය ඕගොල්ලෝ දැන් ඕකේ දැන් ඇහුවාම ඉතින් ඇත්තයි බොරුයි දෙකම ලියන්න වෙනවනේ. දැන් ඕක දැන් ඕගොල්ලන් ඇහුවොත් එම් what are the key public health interventions that has been developed during this COVID-19 එක කියලා. හරිද? COVID-19 එක කියලා first thing is the extensive contact tracing. Right? To what extent there are questions, but you can say first thing is if you have been asked what are the key public health interventions during COVID-19 outbreak, you can tell extensive contact tracing, first one, right? So all close contacts are taken care of. They are either institutionalized or not institutionalized. They are either home quarantine or hospital quarantine, right? And first one. Second one, screening of high risk population. You can have a sample surveys. Then what are the surveys available for this COVID-19 in hospitals? How we collect samples? What are those things? Normally respiratory diseases survey
සාරියන් අයිල්ලයි.
Sorry and ILI, right? Sorry කියන්නේ මොකද්ද ILI කියන්නේ මොකද්ද කියන එක පොඩ්ඩක් දැනගෙන තියන්න. හරි? එතකොට ඒකට අමතරව now these are routine programs, no? Sorry and ILI, they have what you call these COVID-19 sample collections as well. So you can say that there is screening of high risk populations within the hospital community as well as in the community based studies. We screen those urban slums, we screen those fisheries people, we screen these beggars, we screen prison population, we screen within the BOI companies, right? So that kind of thing, right? Right? What is the other thing? Both at the first wave, we were hospitalizing both symptomatic as well as asymptomatic patients. We were institutionalizing the both symptomatic and asymptomatic patients, right? That can be taken as a success story in the first wave, but when it comes to third wave, what is the consequence? When it comes to third wave, it was a liability. Now we are overloading our health system, existing health system, which has been overstretched with patients, right? When you admit all the asymptomatic patients as well, the care they deliver to the symptomatic patients and the space available for the most needy symptomatic patients will be less, right? So that is the other point, right? Then what is the other point? High risk population screening, I told you earlier, right? Then the hospital based sentinel surveillance that I also explained earlier. Then what are the other places where this screening has been done? In this BOI, 5% of the workforce per week, they have to screen, right? So something like that, right? With the example, right? They have deployed that. So what are the other measures? Lockdown strategies, right? We initiated early lockdown strategies for high risk localities, especially during the first wave, right? Then the other thing is public awareness campaign, right? Then adaptation of these selected strategies to discontinue border crossings. ඒ කියන්නේ එක පළාතකින් තව පළාතකට යන එක අපි discourage කළා. Second wave එකේදී. Not in the first wave, in the second wave we discourage from one place to another යන එක discourage කළා. Right? ඊළඟට we limit the public gatherings. ඒකත් අපේ එක intervention එක. Cross border යන එක limit කළා. Public gatherings limit. The final most important thing is what? Initiation of the vaccination, right? So that those are the interventions, that key public health interventions we have deployed during COVID-19 3 outbreaks. කියලා ඔයාලට කියන්න පුළුවන් ඔයාලට තව වැඩි ලකුණු වැඩිපුර ටිකක් ගන්න ඕන අර dream plus v එකත් අස්සකට ගහලා ඒකත් එක්ක කියන්න. Right? Now how the public perception මේ වෙනස් වුණේ කොහොමද කියලා ඇහුවොත් එහෙම තුනේදී එතකොට මොකද කියන්නේ? දැන් first outbreak එකේදී මොකද උනේ? What happened during the first outbreak? People doesn't know anything about COVID-19, but they see that there's a new disease coming in, an unknown disease. We don't know what will happen. We don't know the complications. There is no vaccine at the first outbreak, right? So people tend to fear more. So they will comply with the what the government says. That happened during the first wave, right? Second wave එක යනකොට මොකද වෙන්නේ? Second wave එක යනකොට people are sort of accustomed with this disease. They know little bit about this disease, right? But they know little bit about disease, right? So they sort of are 50-50 again. They will some will adhere to these COVID interventions, regulations, some will not. But the threat is little by little increasing because there are new variants coming in, right? New mutations coming in. So the these new variants and the danger is increased. Third wave ekedi mokada wenne? Now danger is at the highest level, right? But people were so fatigued with all these two waves that they will not adhere to anything at all, right? So your interventions, your public health interventions should be tailor-made to accommodate this public perception as well. අන්න එහෙම ලියන්න. දැන් අර වෙලාවේදී තිබ්බ එකට අපි වෙනම ස්ට්‍රැටජි එකක් තමයි යන්න ඕන. එතකොට අපි මොකද්ද කරන්න ඕන? අර තියෙන threat එක ගැන තියෙන අනියත බිය අපි අඩු කරන්න ඕන first again. Second wave people are complacent. So we have to initiate programs to educate them about the risk of having COVID-19. Third, we have to take extra measures because people are fatigued, right? අන්නේ විදිහට තමයි අපි තුනේදී respond කරේ කියලා දියන්නේ. හරි. එතකොට ඒකේ එක දැන් අර මම කිව්වේ I was previously telling about your specific public health interventions. All these are included in the CCPSL position papers. Now, I think Dineshan has already put it in the chat box. Just read about these things, right? And there's another position paper from CCPSL on vaccination, prioritization of vaccination categories, age categories. Just read on that one as well. And other thing, නිකම් බලන්න food security පැත්ත now since you have nutrition තියෙනවානේ nutrition කාලෙකින් ප්‍රශ්නයක් ආවේ නැද්ද කොහෙද? No questions last year as well නේද? Nutrition
No
no
question from
yeah, so think about this nutrition during this economic crisis as well. They can couple a question like that, right? So what are the things to expect if there is any food security, right? How you can identify a community's food insecure. ඒක කියලා දුන්නද? food insecure කියලා අඳුරගන්නේ කොහොමද කියලා? අන්න ඒ වගේවත් පොඩ්ඩක් නිකන් බලන්න. You can basically identify a community that they are insecure food by 3 or 4 characteristics. First characteristic is they cut down on meals. වෙනදට 3 වේලක් කාපියුම් කන්නේ වේල් 2යි. Right? That's the first thing. Second thing, they cut down on the quantity of the meals. වෙනදට කන්දක් වගේ බත් එක ගහගෙන කාපු එකෙක් දැන් කන්නේ අඬු කෝප්ප භාගයයි. Right? They cut down on the quantity. Third one, they prioritize their meals and give them to the most needy. ඒ කියන්නේ දෙමව්පියෝ කන්නේ පොඩි උන්ට කන්න දෙනවා. Parents do not eat but they feed their children. That's a sign of insecurity. Third one, fourth one, they sort of sell their assets to buy food. They sell their TV, they sell their household stuff to basically to get food. Last sign of food security, they go for these wild foods. වත්තේවල තියෙන දෙයක් එහෙම මෙහෙන් ගලව ගන්න පුළුවන් දෙයකට යනවා මාකට් එකෙන් ගන්න නැතුව. So those are the signs of food security. So they can couple the question very nicely with disaster management and all and food security and put it into this one.
The last one.
Last one, they go for these alternatives, wild foods and all, right? ගහක් කොළක් කඩාගෙන කන්න කියලා කියන්නේ. That is the last one. So those are the food insecurity signs within the community. So as a MOH, as a MOH, how you can identify your communities food insecure, and what are the public health measures that you can implement during this crisis? එතකොට ඉතින් අර ලියන්න යන්න එපා මේ කියන්නේ අර මේ ලොකු අර conceptual level ලියන්න යන්න එපා. You go for this thing, you build this greenhouse stuff and all. එහෙම ලියන්න එපා. You just cut your answer to several pieces, right? First, short-term interventions. What we can do to immediately relieve this situation as a MOH. Second thing, long-term interventions. Long-term interventions එනකොට දැන් ඕක food කියන එක අපිට කරන්න පුළුවන් එකක් නෙමෙයිනේ තනියෙන්. You should have your stakeholders. You should map your stakeholders. Who are the people you can get help out, right? There's a Samurdhi officer in the GS office. There's a social security officer, right? And there's an agriculture officer. ඒ වගේ එකතු කරගෙන program එකක් හදන්න. Right? අන්න ඒ වගේ. Right, risk communication part models kalada health promotion models kalane
Yes.
on natiyawat kiyana me onada man danne UP වලත් එහා ඒවා health promotion model එක health belief model එක එහෙම බලා ගන්න පොඩ්ඩක්. You know about health belief model, no? Right, social marketing බලා ගන්න, health belief model බලා ගන්න, BCC behavior change communication, basics balagan, risk communication එකත් බලාගන්න how you can deploy these risk communication strategies during outbreak, during epidemic, right? ඒක WHO site එකේ තියෙනවා. Very nutshell they have nicely mentioned, right? How these risk communication strategies can be deployed, right? Okay, anything else? විභාගය යන හරි ගමන්නේ මොනවාරි අහන්න තියෙනවා අහන්න. Stat kalane buddhika iya.
Yeah. Oh.
Health promotion පොඩ්ඩක් කුප්පියක් ගන්න. කවුරු හරි කළාද health promotion?
Alagivanasa might do it on 20th.
All right, that's good. Like, he will be the one who is putting all the questions as well. So how many questions done? He is okay. Okay. What else? Anything else? Maybe normally they don't ask about this pharmacoepidemiology and stuff, but maybe causality assessment. The other thing is, I forgot to tell you this post implementation of vaccination. එකක් අහන්න පුළුවන් ඈ. දැන් ඒ කියන්නේ vaccine දීලා ඉවරයිනේ. ඒක කවුරු හරි කළාද? This post implementation stuff. ඒක කළාද? සමිතිසර් කළාද නෑනේ?
No.
Huh? කළාද post introduction requirements of a vaccine program?
Nah. Shall we do it also?
මොකද?
නෑ කරේ නෑ.
හරි නෑනේ. ඒකේ මම broad areas ටික කියන්නම්. ඔයගොල්ලෝ නිකම් පොඩ්ඩක් ඒ ටික බලලා ඒක පොඩ්ඩක් ඒක describe කරගන්න. ඒ කියන්නේ ඒක පොඩ්ඩක් දිග අරගන්න, right? So after introduction of a vaccine, then අපි ඉන්නේ stage එකේ, right? You have what you call post market surveillance නේ. ඒක ගැන පොඩ්ඩක් කියව ගන්න. Post market surveillance means once you establish a vaccination program, you will be getting all the details from these MOHs, how they have implemented this vaccine, how much vaccine they have given, what are the side effects. AEFI, I am not going to do AEFI. You have the notes, no? Read about AEFI, right? And so what they do is post-market surveillance post-introduction program. They do a post-vaccine introduction program. Program planning and preparation. First stage එක තමයි program planning and preparation, right? Second stage එක තමයි program management. ඒ කියන්නේ මේ vaccine program එක vaccine දුන්නාන් පස්සේ කොහොමද manage කරන්නේ කියලා. හරි? ඊළඟට program coordination. දැන් ওই program coordination part එකට තමයි අයිති වෙන්නේ අපි ආමි එකත් එක්ක කරපු programs ඒ ඔක්කොම program coordination. right? Then advocacy, social mobilization, and awareness. That's a key part. Again, අපි දැන් මේ program එක sustain කරගෙන, if we are to sustain this vaccination program, we should have a clear social mobilization plan, clear advocacy plan, and clear community awareness plan, right? That's another point. The next point would be human resource management. Now, our human resource has been stretched to its limits due to these vaccination and all these campaigns, right? So how to manage your resources, human resource. Then training and regular updates. Now, one vaccine comes, then another development comes, one COVID-19 sort of mutation comes, then another variant comes, right? What a train කරන්නේ කොහොමද? How you train your grassroots level workers or public health workers for these things, training and regular updates. Then whole chain management. ඒක අත්‍යවශ්‍ය. ඒක pre එකේදීත් ඕන, post එකේදීත් ඕන. Right? Whole chain management. Right? Then transport management. Vaccine එක තැනක ඉඳන් තව තැනකට ගෙනියන්නේ කොහොමද? Transport, logistics. හරි? program එක අපි implement කරලා ඉවරනන් පස්සෙත් ඉස්සරහට ඒක improve කරන්න අපි ඒක කරන්න. Then the most important two things are supervision, monitoring, and evaluation. Right? Then what? Then surveillance, then data management, waste management. You can vaccine created waste management. The last thing is post introduction evaluation, PIE. ඕක තමයි පහුගිය දවස් ටිකේ CMC එකේ අනෙත් MOH වලටයි එපිඩ් එකෙන් ටීම්ස් ගිහින් කළේ. PIE, post introduction evaluation. It's a requirement of WHO as well as it's a requirement of Epidurate, Ministry of Health. You have to have a post introduction evaluation of the program, PIE. ඔන්න ඔය ටික තමයි program එක මේව කරන් පස්සේ තියෙන්න ඕන.
These all called stages?
Yeah, these are stages. These are sort of how they develop their program, post introduction vaccine program, how they develop in this manner. Right? If you write at least 5 or 6 out of these things, then you will get the marks. Don't forget to write this post introduction evaluation. Right? And variants can here, variants of concern, variants of importance, just as good for your knowledge. I think better you read about this vaccine hesitancy, vaccine acceptance, how you can build a risk communication program to increase this vaccine acceptance. Vaccine hesitancy, vaccine acceptance, then misinformation, disinformation, malinformation regarding COVID-19. Most probably they will last. මේ සෑහෙන කාලෙකින් ඩෙමෝග්‍රැෆි ප්‍රශ්නයක් ආවෙත් නෑ මට මතක විදියට නම් මේ පොඩ්ඩක් බලන්න ඩෙමෝග්‍රැෆි anything else causality assessment එක පොඩ්ඩක් නිකන් උඩින් කියවා යන්න causal දාර pharmacoepidemiology වල තියෙන causality assessment දන්නව නේද ඒක
ඔව්
ඒක පොඩ්ඩක් ටිකක් කියවගෙන යන්න what is post marketing surveillance කියන එකට තමයි එන්නේ AEFI එකයි within this post marketing surveillance there are two parts AEFI right and causality assessment. The AEFI එක කරලා once you done the AEFI and identify cases to be investigated, you should establish your causality. No, for that you have to have a causality assessment. ලියන්න මොනවාම හරි තිබුණ නැත්නම් අර if they ask about this COVID-19 and all, we just write these basic stuff as well. Sort එකක් දානවා, sort එක දාලා මම මෙහෙම කරනවා, situation analysis එකක් කරනවා. At least you will get some marks. Anything else you want to? සාමාන්‍ය හරි තියනවාද මේ දිනේෂාන් අපිට?
Okay, Dinesh.
Okay, ne. And can we get that PowerPoint presentation with those questions and answers?
Right. I'll
Alright.
send it to Dineshan.
Right.
Oh,
Okay, thank you.
Shamali as well. Yeah, ඒ ටික ඒ වගේ පොඩ්ඩක් බලන්න. ඒ ලයින් එකේ පොඩ්ඩක් බලන්න. අනිත් එක අර මම
Alright.
කියපු විදිහට මේ basically plan කරගන්න. නැත්නම් මේ කියන්නේ ඇත්තටම you will what you will get is not you have all these knowledge නේ. This is sort of a vast area නේ. So you have to funnel these all these knowledge within this 3 hours. So the time is the issue, right? So the best thing is you plan what are your strengths and what are your weaknesses and accordingly do, right? එහෙම කළොත් ඔක ගොඩ දාගන්න පුළුවන්. Don't just I mean spend time on one question, then it is over. Basically it is over, right? එකකට වැඩි වෙලා ගියොත් සෑහෙන වෙලාවක් ගියොත් අනිත් එක කවර් කරන්න බෑ. මොකද අන්තිම වෙනකන් ලියන්න වෙනවා. Right? So manage your time very nicely, then it's easier. And when you write, if you can just structure your answers and මොනාරියෝ diagrams ටිකක් ඇඳලා අර බෝල ටිකක් ඇඳලා conceptual framework දානවා වගේ මෙන්න මෙහෙමයි වෙන්නේ කියලා ඒවත් ටිකක් include කරන, then you will get the extra marks. And read about planning, because they will put a planning question, a sub question into every question. Right? Okay, then if I remember, yeah, sorry.
Okay.
If I remember any other thing, or if you have any question, just send me a message or email. I think Dineshan and a few others have my number as well. So
Right.
anytime if you have any issues or any other areas to be cleared, just send me a message. I will try my best, right? Okay then.
Right.
Good
Thank
luck.
you very much. Thank you.
Thank you.
Thank you very much.
Thank you.
Thank you very much.
Thank you.